I've been working with the great people here in TCI for about 7 years. I started by coming to do education sessions with Accreditation Canada. And from there, I worked with an individual who was responsible in IntraHealth for the Caribbean in terms of the clinical aspect. So I worked with her when the hospital was first opening to prepare the policies and procedures. And then I was asked to stay and help prepare the hospital for the first accreditation survey. So that was back quite a few years. And so since then, I've been coming on a regular basis just to ensure that progress continues to be made, that the issues that I identify sometimes when I'm here can be corrected, and I try and give clear direction as to what kinds of things needs to be put in place. So I've worked with the organization for the past 2 surveys, and you have been fabulous. You've achieved your diamond status, which is great, and that's what we're working towards. Accreditation is a process that uses international standards to review administrative, clinical, and support services in hospitals. So experts are asked, for example, again, I was saying in oncology, experts in cancer care are asked to develop standards of practice, standards that can be used to assess hospitals across the board. These standards then are communicated to the hospital in very great detail, and the hospital and the staff are asked to actually ensure that they have the things in place, the processes in place that meet the requirements. Once that's completed, the surveyors who are selected, they are senior administrative, senior clinical people who are asked then to use these standards and go to the respective hospitals to see how well those hospitals have actually complied with the standards. And so on the basis of degree of compliance, you then identify where the gaps are in compliance for the hospitals, and then are able to determine if they are at a particular level. So are they gold? Are they diamond? And there's variations in between. When standards are first developed, they are put out to a large group of people and are asked for responses to determine whether or not these standards are meaningful, whether they communicate the kinds of intent that they're supposed to communicate. Then the standards are trialed in a number of different settings, and from there revisions and modifications are made. Once that's established, then those standards are sent out to organizations. On a regular basis, the standards are reviewed again. Are they still current? Do they still make sense? And sometimes standards are removed because they no longer apply. Sometimes additional ones are added. Quite a number of years ago, Accreditation Canada identified required organizational practices. And these are practices that an organization must have in place in order to be accredited. And they're usually very forward-thinking. Accreditation Canada tries to determine where healthcare is going and where it needs to go and what emphasis needs to be placed on particular processes. So the required organizational practices identify those processes that are an absolute must. And those are the things when we prepare organizations for surveys, that's what we focus on. JCO does exclusively the US plus an international. There's an agreement between Accreditation Canada and JCO that Accreditation Canada will not survey American sites, JCO will not survey Canadian sites, but it's an open ball game for international sites. And many organizations, particularly in the Middle East, have asked Accreditation Canada, JCO, and also the Accreditation Society in Australia to survey and to certify their organizations. In the Middle East, the certification banners at the front of the private hospitals is a drawing card. So sometimes some hospitals do nothing but accreditation. The value is in helping to teach the staff that continuous quality improvement becomes totally assimilated, integrated into their everyday working life. In addition to the continuous quality improvement, the second focus is safety, because our whole essence in terms of healthcare is to make sure that we are safe and provide safe care to patients, to also their families, but also involving staff, So it's twofold: continuous quality improvement and a real focus on safety.